Welcome to episode 13 of Your Life is the Medicine. I'm your host. I'm Dr. Sonny Miles. I'm an integrative and palliative care physician. And this podcast is about how your life affects your health and well being. So today, I really want to talk about International Women's Day. I am recording this a couple of days after International Women's Day, which was March 8th. And I wasn't planning on doing an episode on Women's Day, but I really wanted to. And so I want to talk about how women's lives, the things that women go through every day, the things that women survive, the ways that women thrive, are extraordinary examples of courage and resilience and strength and wisdom and all the good adjectives you can think of. Like, women are amazing, and women go through so much that isn't acknowledged or talked about that we know and carry in our bodies and understand, and yet it isn't talked about enough. And I'm grateful for all of the conversations that are happening about patriarchy, about misogyny, about women's, the somatics of that show up in women's bodies. And it's not enough, right? Because we still live in this world that in many ways is unsafe and requires us to survive, requires us to keep ourselves safe, requires us to navigate really challenging situations that threaten our safety oftentimes. And so while the conversations are hopeful, I want to acknowledge that I want to acknowledge the costs of being a woman in the world that we're in today. And as a physician, and especially what I see in my own private practice, is how patriarchy shows up in women's bodies. And I want to talk a little bit more about that. So, first of all, Women's Day is a day that's been close to my heart since I was a Peace Corps volunteer. When I was in the second year of my Peace Corps service in my community, I hosted a small gathering for the women in my community to celebrate them. It was, a couple hours. I read some poems, talked about women in my community, and we had cake and socialized. And it has stuck with me for 20 years. And it may not have stuck with them, but it has stuck with me. It impacted me, and it is something that I carry with me. I lived in a small community of about 30 houses, 30 families in rural Paraguay. I was an environmental education volunteer, and so I spent a lot of time in elementary schools, primarily the one in my community, but in elementary schools, talking about the environment and basic science education. But my job description as a Peace Corps volunteer was really to do anything that I thought could help my community. And what I set out to do initially was really just build relationships in my community. And I did that by visiting houses, by visiting women in their homes. And they embraced me. They were curious about me. They took care of me. They cooked for me. They worried about me. They made sure that I was safe, and I felt embraced, and I felt loved, and I felt cared for. And during the time I spent in their homes, cooking with them, talking with them, drinking tereré and mate, they also told me stories about their lives. And through the stories, I understood that many of them had suffered from health struggles. They suffered violence at the hands of the men in their lives. They were financially dependent often on their families, and so they didn't have a lot of choices. Many of them didn't have a lot of education, and yet they were so resilient and courageous and advocated for their kids and held together their families and their communities. And so with my small Women's Day celebration, I just wanted them to feel highlighted. I wanted the essence of who they were and what they did to be more visible and more seen. So International Women's Day was actually started in 1911 to bring attention to struggles of women, women's suffrage, women's labor movements, etc. It was officially recognized by the United Nations in 1975. So, like many things, it took many, many years between when the effort first began and when it was officially recognized in the world. And so now we're in 2026. It's been about 50 years, and it's a celebration, and I think it's growing. I think more and more people are, or at least more and more women are celebrating Women's Day. And and that's hopeful to me. And I, in my own work, want to celebrate women every single day. When women work with me, either in my circles or my retreats or my one-on-one practice, like my hope is that they have a better understanding of how resilient and extraordinary they are, because we we live in our bodies, we live in our lives, we just take care of things and get things done, and we don't realize how much we're actually doing. Like, so much of what we do feels invisible, and yet women are extraordinary every single day. And so that's part of what lights me up about my work, is that I get to help women see themselves differently and see their own courage and their own resilience, and help them understand why their bodies feel the way they do. And so I want to talk just a little bit about how patriarchy shows up in women's bodies. And I'll start with some of the obvious ways of how patriarchy shows up in healthcare and in women's healthcare. And one of the first, like, big examples obviously is menopause, and the fact that for many years menopause wasn't even hardly talked about, that women went through menopause without a lot of guidance or support or education on what was happening and what to expect, and minimal support on how to feel well through menopause. And I trained when in the early 2000s, I was a medical student 2006 to 2010, and in residency right after that. And the Women's Health Initiative had come out in the early 2000s. And so the pendulum had swung to, like, don't use hormone replacement for women because we don't think it's safe. But there wasn't really good alternatives in place. So essentially, many women suffered without a lot of support. In sort of the integrative and functional medicine worlds that I am part of now, the pendulum has gone back in the other direction of, like, hormones are potentially beneficial and should be available for everyone and should be available to everyone. And I think, it's always the swing in the middle. But the real challenge is we don't have the studies we wish we had to really take care of women. And there's still so much confusion around what benefits women, what is safe, what is healthy, what is effective. And so, as you know, women weren't even included in research studies on for drugs and treatment until rather recently. And so patriarchy is in the structure of healthcare and how women's health has been approached. It is that data were extrapolated to women. It wasn't that women's health issues were studied. Start over, Nicole. Patriarchy is in the structure and the system of how women's healthcare has been approached. The data from studies primarily looking at white men were extrapolated to women, but women weren't studied to understand how their needs differed from men. And so there is more research being done now, but there's a huge disparity in data for women's health issues compared to men's health issues. The other way that we see patriarchy and misogyny show up in healthcare is, and I'm talking not about individual healthcare providers, but the structure of healthcare, is that women's health struggles are diagnosed. Like endometriosis takes years to get a diagnosis, and people often still don't get adequate treatment. Women's pain is treated less. Women are often told that they have anxiety, or women who have kind of a constellation of complaints and symptoms that don't fit in clear boxes often feel dismissed and don't get diagnoses or treatment. And so there are huge disparities in how women are treated within the healthcare system. And again, this isn't, certainly there are people in the healthcare system who are dedicated to helping women. And so this is a comment more on how the structure of healthcare and the ways that we have all been educated as physicians have not been equitable for women's health. I would say the things that I see in my private practice, which is a small integrative and functional medicine practice in Colorado, the women that come see me, because I work exclusively with women, and people ask why. And the why is because that being in a woman's body is what I understand. I understand on a very deep embodied level how my own journey has shown up in my body. And that's what I want other women to understand or to help other women see. I have no idea what it feels like to be in a man's body, or what the world does to a man's body. And so I really have chosen to work with women on a very deep level, the level that I understand after having done a lot of my own work. And so what I see in these women, and many of these women have autoimmune disease or more kind of difficult to diagnose things like POTS and mast cell activation syndrome, kind of chronic fatigue type illness or long COVID, and a lot of anxiety or depression, but often a lot of anxiety. And so the way that I understand that some of this comes about is, number one, many women don't feel safe in their bodies or have never felt completely safe in their bodies. And it shows up in it's taught or evolves in different ways. And so it may be that that a woman suffered abuse at an early age, and so her nervous system learned to be hypervigilant from that or those experiences. It may be that someone who was very sensitive to the emotions of other people around did not get emotional attunement or emotional safety and learned to read the room. And so never felt completely safe. And her nervous system learned to constantly read the room to see who was going to get angry or what was going to happen. And this is like Brene Brown in one of her talks or books said that her superpower was predicting the future, that she knew exactly who was going to explode or get mad. And I'm paraphrasing the way that I remember it. But that's the hypervigilant nervous system, the woman that often the young girl or the adolescent or the adult woman that is reading the room, whose nervous system is constantly scanning to figure out who's upset, who might get mad, and to modulate the energy and pacify everyone. And that's a tremendous amount of energy that woman is spending to keep everyone, to keep things safe and to keep everyone calm and as regulated as possible. So the nervous system regulation is a huge piece of what I see and work with in my patients is that many of them either didn't have a nervous system that developed to recognize safety or lost safety somewhere along the way. And there's a somatic psychologist that I follow on Instagram whose work I really love, and she says something, and again, I'm paraphrasing, but that much of the trauma world again is in studied in like veterans who had essential, nervous systems, went to war, had something traumatic happen, and then returned. And so you're trying to return to the nervous system that was safer or more regulated before, or studying primates, or I believe primates. And that is very different for women whose nervous systems were shaped by the male gaze, by this lack of safety going through childhood and young adulthood. So we don't have the like safe nervous system to go back to. Many women need to kind of reset or relearn to recognize safety and to come into a place where their bodies can feel safe. And so, again, often that shows up in my patients with some anxiety. And again, this scanning the world in many ways to look for safety or to look for threats. The other way or the other example I really use a lot is thinking about fatigue. And when we think about fatigue from an integrative or functional medicine perspective, or even a conventional perspective, we're thinking about, you know, thyroid and anemia and maybe your cortisol curve and all of those and those types of things. But part of fatigue is for many women who learned that being safe or being worthy meant striving, meant achieving, meant showing that you were worthy, meant being productive. That's exhausting. Like going through the world where you are constantly striving, you are constantly trying to prove your worth by being productive, and you're scanning the room to make sure you're safe. No wonder we're fatigued. No wonder women come in with years of existing in a way where they feel that their worth is being measured by what they're doing. Like that's exhausting. And then you add on all of the different roles that women are expected to flawlessly manage, right? A career, caring for aging parents, perhaps, motherhood, perhaps, being a wife, and taking care of yourself. Like, make sure you do all that self care too. And so, this is what patriarchy is, right? Patriarchy says, like, this is the way a woman is valuable. These are all the things a woman is expected to do. And be quiet. We don't want to hear about, we don't want to hear from you. Like, be quiet. And so that show again, it shows up in things like chronic fatigue, in just feeling like you're surviving. I hope that makes sense. I haven't I it's again, I think these are subtle. The way that I'm trying to talk about them is to understand on on subtle levels how that shows up in our bodies, that most of us, our ways of performing in our careers and in our families have been deeply influenced by the patriarchy and and how women are expected to look, to perform, to be, and what we're expected not to do, say, or be. And that over time shows up in many bodies, especially in women who are more sensitive, or, and I don't mean that in a negative way, but whose bodies are more sensitive, more empathic, and who are kind of reading the room all of the time. That often shows up in fatigue, in anxiety and depression, in not trusting your own body, and even in chronic illness, autoimmune disease, and things like that. And it's part of part of the healing journey is to understand how how this societal conditioning is affecting you, your well-being, and your body, and working on unlearning some of that conditioning. And so it's a journey. It's a beautiful journey, but it is a journey. It's not the quick fix to how to feel better. Even though it's not quick, it's definitely worth doing. It gives you the goal is self-love, unconditional self-love, and self-trust and freedom to like authentically be and do you. And so, again, I kind of wandered all over the place, but I hope that gives you a better understanding of how I see illness and wellness, and understanding how the burden there's beauty in being a woman, and there's still some burdens in terms of how we exist in the world and what is required of us in the world. And I am so grateful to every single woman who is unlearning, who is taking step after step forward to change the narrative, who is every woman who is becoming more authentically herself day by day, year by year. And that is the gift of midlife. The gift of midlife, at least as I see it, is that ability to say, hey, I performed, I did all of this stuff, and I'm not doing it anymore. I'm going to figure out a different path that really honors me, that honors my body, and that creates joy and meaning and beauty in the world. So, again, I want to celebrate you. I want to celebrate your beauty, your wisdom, your strength, your resilience, and your courage as you walk through each and every day. And one of my favorite poems is Phenomenal Woman by Maya Angelou. And I'm not going to read all of it, but I'm just going to read the last piece. It says, now you understand just why my head's not bowed. I don't shout or jump about or have to talk real loud. When you see me passing, it ought to make you proud. I say, it's in the click of my heels, the bend of my hair, the palm of my hand, the need for my care. 'Cause I'm a woman, phenomenal woman. That's me. Happy International Women's Day. You're a phenomenal woman. Honor and celebrate you and see how much you do. See how much you do. Feel it. Take it in. Thank you for being you.